Welcome to the In My Opinion show with Henry Hatter and friends. This afternoon I have as guest Pat Wardell, the CEO of Hurley Hospital. Welcome, Mr. Wardell.
Thank you.
Uh, Mr. Wardell, respectfully, I would like to have you talk about yourself a little bit and why you think that you're the person that ought to lead the charge for this millage for Hurley Hospital.
Well, I've been, well, first of all, thank you very much for inviting me here today to talk about Hurley's millage. I've been at Hurley now for 4 years and have had a chance really up close to understand what Hurley is, what it does for the community, and to be comfortable that it's also a very efficient and good financial steward. And have really grown to respect Hurley in all those aspects. So why am I the right person? I guess because I've had probably the best opportunity of anyone else in the community to see up close the kind of resource that it is. Hurley's been here for 100 years, and under my stewardship, I want to ensure that the community gets the care that it needs and that we're around for a long time.
Well, thank you. Now, Pat, there is a diverse audience watching this show tonight. They are culturally different and they're geographically different. And each one of those segments, we're looking for you to thread through their issues so that you can assure them that all will have something to gain by this millage. We're going to start out. First, I'm going to ask you this question. Please tell the audience who you are, what you've already done. What is the Hurley millage for? What is the proposal specifically?
Well, yeah, the Hurley millage is for 3 specific areas. The first is that Hurley is a safety net institution providing certain specialized clinical services. And I characterize those as trauma, where we see over 1,600 people a year, the only level 1 in the area. A level 3 neonatal intensive care unit, the highest in the area once again, a burn unit, and the full service children's hospital. These are all services that the community needs to be vital, and we get patients from all over Genesee County, Shiawassee, and Lapeer. The second is that there's no question that our community is going through its most difficult economic times since the 1980s. We're seeing dramatic increases in the number of people losing their jobs, getting pink slips, and finding themselves without insurance. The numbers have risen just in the last few years of uninsured hospitalized patients from 900 to 2,700. We want to make certain, as the public hospital for this community, that we're there for all of those patients who are uninsured and underinsured. And the third aspect is, as a public hospital, we have a special commitment to keeping the community well, towards reducing morbidity, and whether that's working with the city of Clio on their health initiative, or Mount Morris, or any other community in Genesee County that asks for help. It's important for us to be addressing issues like obesity and high blood pressure and infant mortality and injury prevention in children. These are all vital, and these are the ways in which the money will be spent.
Now, what are you asking the public specifically or the taxpayers specifically to do for you?
The proposal that has been approved and put on the ballot by the county commissioners is that Hurley would receive a .9 mil, which for the average home valued at $125,000 in this community is approximately $55 a year. We're asking that that property tax be levied and that the Hurley then be held accountable to spend that money wisely through a contract that will be developed between the county leadership and the leadership at Hurley.
There are those who would say that Hurley Hospital is engineering the outcome of the vote by having it at this time. Why not at a general election when more people are engaged? What would you say to that?
Well, I think the first thing I would say is that the economic crisis is something that really hit home for all of us, I'd say last August or September. and that we have seen it grow and we have seen it affect our community in many negative ways. We felt it was important to ask for this so that we can provide the service and not wait until I believe it would be August of 2010 for this. That would be like closing the barn door after the cow's been stolen.
So you can prove that this is not an opportune time for the vote to come out favorable to the residents of the city of Flint. That is the issue.
You know, I think that there's no question that there's a mayoral election, there's a council primary that's in Flint, and that's generated a lot of interest. Flint has about 100,000 people. The rest of the county has over 300,000. We've made this a countywide initiative. This morning I was in Clio. Earlier this week I was speaking before a fraternal group in Swartz Creek, and we have been going to churches, and we have been going really wherever we're invited to talk about this. Next week I'll be speaking to the Chamber of Commerce in Grand Blanc. So we're bringing this issue out. We very much want the debate. We very much want people to understand why we're asking for this. And we think if we get our message across, that most people will be very much in favor of it because of the services that Hurley provides.
Well, thank you. Now, the remaining time on the show, I would like to dwell on questions that are really pivotal to the outcome and the success of this millage. And they'll be challenging questions. So I hope that you will give us some good basis for making judgments on August 4th.
Good.
And you should, I would hope that you, on the scale of 1 to 10, that you would score about 6 to 7. Because I think that people are going to take a look at every issue you talk on tonight and how it's somehow favorable. It's favorable to them personally, or to them culturally, or to them group-wise.
Mm-hmm.
And and that makes a good discussion that will continue to build dynamism around the issue. What would you say to a critic of the millage who would ask, if Michigan and Genesis are surviving without support from the public, why not Hurley?
You mean McLaren and Genesis?
I'm sorry.
Yeah. The principal reason is that Hurley, as a public hospital, takes care of 70% of patients throughout our region who have no ability to pay. We take care of 70% of Medicaid patients. We also offer an array of services that typically are not profitable ones. Children's Hospital, as an example, on a scale that Hurley mounts it, would never be a profitable enterprise. You wouldn't choose to go into it as a money-making opportunity, but you'd very much want to have that resource in your community. Likewise with level 1 trauma or a burn center. So these are services that typically are not profitable, and ones that we have to work hard to maintain and to build and strengthen. In the case of the other two hospitals you mentioned, they do their fair share certainly, and they are good community, upstanding members of the community, but nevertheless take care of a much smaller portion of the underserved.
Well, there's a second very, very sticky question that you need to respond to. Many people say that they're afraid to visit Hurley Hospital. It is not isolated, it's contiguous with the community around it, and they don't feel that it's safe for guests and for families. What would you say to that?
Well, I can say that what I hear from people is that once they visited Hurley for the first time, that those fears really go away. I think if you're unfamiliar with Flint and if you have discomfort in an urban environment, that your first visit it may feel that way. But I can tell you, in all honesty, that we are a safe hospital. The number of incidents that we have are no different than suburban hospitals, and we have a very good security force and a very vigilant staff in general. So I think that once people do visit, and I think especially since sooner or later so many people are going to need one of those critical safety net services that I mentioned, that people are comforted and feel good about the fact that their loved one is getting the care that they need where they need it, which is close to home.
Now, many people watching this show will not know what a safety net is. Could you specifically spell out what a safety net is?
Well, a safety net hospital is pretty much as I've been describing Hurley. It's a facility that offers typically trauma, neonate, children's facility, burn, and also makes a special effort to reach out to people who are unemployed, people who become uninsured, so that they can receive the care that they need. And so it typically has a financial mix that skews more towards people who can't pay. However, we have lots of people at Hurley as patients who can afford and who do help balance that out. But a safety net is basically one that offers that array of services and has a special mission to the poor.
Now, I want to go back to the fear that Hurley is not a safe place for patients to visit. What kind of feedback are you getting from other communities? Do they have the same perceptions, even though I believe data support that the hospital is safe? But what kind of, you're visiting various areas of the county, are you getting the same kind of perceptions that you would get from other parts of the county outside of the city of Flint?
Well, I can tell you very honestly that I've been here 4 years, and on a very routine basis, I'm out speaking to different groups. And invariably, when there's a lull in the conversation, people start going around the table expressing their Hurley stories about children who were cared for, babies that were sick and became well, trauma cases. And I really hear very little from people about that fear, especially, as I said, once you've been here or if you're originally from here. We're a half mile off the interstate, and I think most people, once they've been there once, feel very comforted, and there's a sense of safety in our parking garage and certainly inside of our building.
Well, you get a lot of feedback from the community. Just thinking over the numbers of perhaps individuals that you say you've talked to, base it on the percentage out of 100. How many people would you say that you encountered that say that they were born at Hurley Hospital?
My goodness. I was at a church service this weekend, and the pastor asked people to stand up who had been born at Hurley, and it was more than half the people in that room. But Dale Kildee sometimes jokes that he's the oldest person ever born at Hurley. So a very large percentage of the community. I have to think that it's at this point probably close to a half who were born at Hurley.
Now, you've given us a lot of background on the expertise of Hurley in various areas of medical care. Is Hurley doing more to partner with the city of Flint, with churches, with the community, to dispose of the feeling that the hospital is an unsafe campus?
Well, I think one of the responsibilities we take seriously is as a partner in the community. And community building is an important part of that. We have recently, in the vicinity of the hospital, created green space on a total of 5 square city blocks. We have a master plan that calls ultimately for the construction of homes on much of that space. We also have been working with the Downtown Development Authority and have been working on the improvements along University, connecting Kettering to downtown. Employing 2,500 people who are spread throughout the county in terms of where they live, we take a much broader view, though, And whether it's working with the Health Initiative in Clio, or it's partnering with others who come to us with issues and concerns. Last year, as an example, we had 21,000 encounters in our childhood injury prevention division. A lot of those having to do with how car seats are anchored, because so often car seats are improperly installed. And we do that all over. So there's community building in the immediate neighborhood, but I think even more so in terms of our regional presence. You see Hurley out there everywhere when it comes to issues around infant mortality and around injury prevention for kids.
Okay, now next, very difficult question, and you've not been exposed to this question from this perspective, in my opinion. But and that's the problem of governance.
Mm-hmm.
The greatest problem and the greatest challenge that, in my opinion, sees that's a threat to this millage is the one dealing with governance.
Mm-hmm.
There are those who would say Hurley Hospital is operated by the city of Flint. And for you to come out and ask people who live in the county without representation in the process will cause tax without representation. How do you respond to that?
Well, I think two things. The first is that we have always viewed ourselves as a countywide, in fact, a regional facility. When you look at where our safety net patients come from, they come from all over. When you look at where our employees are from, they're from all over. 304 of them are my neighbors in Grand Blanc. So it's very much a regional institution, and the county's been getting a benefit from that throughout the history of Hurley. But more specifically to your question, there will be $10 million that will be set aside. There will be a contract written up. That contract will have specific performance criteria, just like any contract that would be written up between two parties, where Hurley would be called to perform. There will be an auditor that we will pay for, who will be in the payroll of the county, and they will see to it that $10 million is spent the way that is specified in the contract. If we were not to perform on that, then the county would not pay us. I think that's only fair and right. So the notion is that $10 million will be under the control of the commissioners who are elected by the people in the county, and it will be spent in accordance with what the commissioners have in mind. The other thing I would respond to in this regard, Henry, is that we have 5 board members who are from outside of the city of Flint. One of them is the immediate past chair from Flint Township. The other is, who will be appointed chair tomorrow, is from Grand Blanc Township. And it has been a terrific board, and they have helped guide us during my 4 years to a $21 million improvement in financial performance. So we've got a good board, and we'll have a contract with the with the county, that will specify exactly how that money is spent. And if we don't spend it that way, then we've got no right to it, and we shouldn't be paid it.
Well, in this day and age, people in general are dissatisfied with government. They have a disillusion with government. They don't trust government very easily. And I think, despite of the fact you've made the case that the county would see that the money is properly distributed so that all people benefit.
Mm-hmm.
But how do you get over the perception that there are people who still believe that we ought to have a tea party?
Mm-hmm.
And linger on, because the county itself, the townships don't provide or endorse a candidate to the Hurley board that would represent their interest throughout the county. You got 15 board members, right? Okay. And 5 of those are from the county. It would appear to me that some of the negative criticism is about self-governance and about representative governance, I should say. And they would see more productivity and relevance if they saw, say, for example, Genesee Township sponsored one person to the Hurley Hospital. I think that's what most people would anticipate. Is that your feeling? Or
Well,
not?
I think if
and
the-
your response, does it address that perception out there?
Well, I think that if you look at this as a transaction, that there's a set of services that the county would like, and they want to buy it, and they want to buy it from Hurley, then this is not an ownership. It's a transaction between someone who wants a service, needs a service, and someone who will provide it. So I tend to view it more in that respect. Would it be ideal if we had an authority that had broader representation? I don't think that that's necessarily a magic bullet. And Henry, I can tell you that over the last 4 years, I've had numerous conversations with city leadership, county leadership, members of the community. And one question which I've put to some is, here we have Hurley Hospital. Until recently, it was losing, on average, $7 million a year. Would you like to have half ownership of that? And in the event that it fails, you're responsible. Now, I would hope that my county commissioner would not jump at that as an opportunity, but would see it as an issue. So I think this arm's length vendor relationship is certainly one that I think makes sense. But I can tell you that in meeting with many people in the county and in the city, that there was very modest support for that concept. As we've gone out to the public, I think that what we've heard, and we've gotten a very good response to our phone calls from throughout the county, not just the city. The majority of people are very supportive of this millage and have a Hurley story and a Hurley connection. Their concern is with the quality of the service. Their concern is that Hurley's there for them when it's needed. And they know that sooner or later that one of their friends or loved one of themselves is going to need the services that Hurley provides, and only Hurley provides.
I got about 3 minutes, and I wanna have you respond to two questions. The first one is, there are 3 other hospitals in the area, okay? McLaren and Genesis. Do you have a clear-cut resolve and support from them for the Hurley millage?
We have a clear and unequivocal support from McLaren, and Genesis has opted to stay neutral on this. We've gotten endorsements from Genesis nurses. We've gotten endorsements from numerous other organizations, but including Hamilton, which is the federally qualified health center. But as I said, Genesis has decided to stay neutral on this subject.
Well, that's kind of interesting because that would be tantamount to letting the marketplace decide the fate of institutions and American businesses. And I think, as you said, you're probably trying to meet a need that's very necessary, and the community then that helps us with stability. Now, just with respect to Hamilton, Hamilton is also a safety net. How is then Hamilton, are you competing for the same kind of patients?
I don't view that we compete at all. I think that Hamilton and Hurley are complementary as safety net providers. We have the specialists, we have the inpatient facilities, they have the primary care outreach. We have some of that too, but I think more partnership between us will benefit the community. It's something we look forward to pursuing this year, actually.
Do you see the same kind of relationships with Hamilton, with Genesis and McLaren to respond to the same kind of need? Partnerships to
in
help
terms
you
of
care,
partnerships?
to make the patient first.
Well, Hurley's always had a lot of partnerships with the other institutions. The Genesis Hurley Cancer Institute's an example. The cardiology programs between McLaren and Hurley. All sick children from McLaren go directly to Hurley. Most from Genesis go directly to Hurley. So there's a long-standing level of cooperation there. And then in medical education, we collectively are responsible for the education of 40 medical students each year. So there's a lot that we do in common. And I think that all three hospitals have a good reputation in terms of being concerned about the community. Each has a unique role. In the case of Hurley, it's the least financially viable role, but nevertheless an essential role, especially in the kind of economy that we're living through.
Well, Pat, in the time remaining, I'm going to give you a chance to respond. We got 1 minute to respond to why Hurley is a necessary facility to survive in this community, and also and to make your appeal to the people to vote for this issue on August 4th. Would you do that in 35 seconds?
In 35 seconds, I think everyone sooner or later is going to have a connection to Hurley if you don't have one already. The safety net services that we offer are really unique services. It's the only NICU, it's the only children's hospital, it's the only burn unit. It's the level 1 trauma center that the level 2s send their patients to. People's lives have been saved, people's health has been restored because of that. These are things that are vital. I also think that at a time when
Okay, well, our show has to come to an end. I'm sorry to cut you off. We had a great discussion. I hope you made the points that you had hoped to make. And today, I've had Pat Wardel, the CEO of Hurley Hospital, and this is Henry Hatter and friends saying until next time, stay focused.